When sizing the cane, you want to make sure that the cane is at the right height for your patient. In this case, the cane is too tall. To adjust it, you must press the button or pin down while simultaneously pushing up or pulling the bottom of the cane to adjust it to the correct height. As you can see, the cane is now at the right height, as it is level with the patient's wrist crease. Hand placement for the cane is very important. When using a cane, you want to make sure that the cane is on the opposite side of the affected side. In this case, the weak side is the left side and the cane is on the right side. Now we can move on to gait patterns. The first gait pattern is called a 3-point gait pattern, in which the cane goes first, followed by the weak or affected leg, and lastly the non-affected leg. We can now progress to a 2-point gait pattern. This pattern is more natural as you simultaneously move the weak or affected side and the cane, followed by the non-affected leg. Now that you've learned how to size your patient's cane and different gait patterns, here are a few things to avoid. One is to make sure that the cane isn't too far away from your patient. You want to educate your patient on proper body mechanics with the cane. Ideally, you want the cane to be close enough to give them support. You should also emphasize that having a cane too far out can put them at a higher risk of losing their balance, as the cane is not providing enough stability and can cause them to have excessive forward posture, which can result into a higher fall risk. Adjusting a walker to your patient's height is similar to the single-point cane. The walker's handle should be aligned with the patient's wrist crease. When adjusting the walker, it's just like the single-point cane, except there are 4 legs that need to be adjusted. Here's a 3-point gait pattern using a walker. First, instruct the patient to push the walker forward, followed by their weak or affected leg, and lastly, the non-affected leg. Here is a 2-point step-through gait pattern. In this pattern, the leg advances beyond the opposite leg. This results in a more normal pattern as the movement is continuous. Just like the cane, you want to avoid the walker from being too far from the patient. This will cause them to lean forward and lose their balance. Encourage the patient to have upright posture to prevent this. Adjusting the axillary crutch is similar to both the walker and the cane. As you can see, the crutch on the right is much taller than the crutch on the left. When adjusting the crutches, make sure that the crutches are about 4 to 6 inches away from your feet. This should cause a 2 to 3 finger distance between the axilla and the crutch pad. The hand grip should also be aligned with the patient's wrist crease. To recap, adjusting the crutch height is similar to adjusting the walker and the cane. In this scenario, the crutch needs to be shortened in order to match the opposite crutch. Now that the crutches are properly adjusted, let's move on to a 2-point swing-through gait pattern. In this scenario, the left leg is the non-weight-bearing limb. Instruct your patient to place the crutches in front of them and have them push off with their non-affected limb to propel them forward in a swinging motion. Next, we have a 2-point step-2 gait pattern. In this scenario, the patient is able to bear some weight on the affected limb. With this pattern, instruct your patient to bring both crutches forward, then the affected or weak limb, and lastly, the non-affected limb.